How to treat pilonidal cyst, successful home treatments, top 5 home remedies for pilonidal cysts. Pilonidal cysts are a type of chronic skin infection that occurs in the region of the buttocks crease. The cysts develop as a reaction to ingrown hairs or hairs embedded in the skin. While the exact cause of pilonidal cysts is not known, experts believe they are caused by loose hairs that penetrate the skin. The body considers this hair a foreign substance and the immune response against it leads to the formation of a cyst around the hair. Any trauma to the buttock region may also contribute to the development of pilonidal cysts. Initially, there will be just a small, dimple-like depression on the surface of the skin. However, once infected, the depression becomes a swollen mass. It can be a closed sac filled with fluid or an abscess where pus collects. Other signs and symptoms include pain and discomfort when sitting or standing, inflamed skin, drainage of pus or blood from an opening in the skin, and a bad smell from the pus. If the infection is severe, there may also be symptoms of fever, malaise or nausea. This type of skin infection is more common in men than women. The risk is higher in obese people and those with excessive body hair as well as thick or coarse body hair. An inactive lifestyle or job requiring prolonged sitting also increases the risk. Mild cases of pilonidal cysts resolve naturally and require little treatment. However, in some cases, prolonged treatment as well as surgery may be needed to reduce the size of the cysts and prevent infection. Here are the top 5 home remedies for pilonidal cysts. 1. Warm compresses. To get relief from the severe pain, applying warm compresses to the affected area is very effective. A warm compress also will help the fluid and pus accumulated within the cysts to drain quickly and the healing process will begin. However, warm compresses will not prevent the growth of pilonidal cysts. Soak a washcloth in hot water and wring out the excess water. Hold the warm cloth on the affected area for a few minutes. Repeat 3 or 4 times a day until the fluid starts draining. Alternatively, you can take a hot sitz bath or rinse the area with warm water for a few minutes. 2. Tea tree oil. Tea tree oil is another very effective remedy for this painful problem. This oil has healing and curative powers in the form of antibacterial, antifungal and anti-inflammatory properties, which can keep an infection at bay. Plus, as the oil penetrates deep into the skin, it promotes faster healing. Dilute tea tree oil with water in the ratio of 1:10. Apply it to the affected area and leave it on for 10 minutes. Rinse the area with lukewarm water and pat dry thoroughly. Use this remedy 2 or 3 times daily. 3. Apple cider vinegar. Using apple cider vinegar can also help treat pilonidal cysts. Its anti-inflammatory property helps reduce pain and inflammation. In addition, the antiseptic and antibacterial nature of apple cider vinegar prevents bacterial growth that can trigger further infection and delay the healing process. Mix 2 or 3 teaspoons of organic, raw, unfiltered apple cider vinegar in 1/2 cup of warm water. Soak a cotton ball in this solution and place it directly on the affected area for about 1 minute. Repeat this remedy 3 or 4 times daily for a few days. Alternatively, add 1 teaspoon of raw, unfiltered apple cider vinegar to a glass of warm water and drink it twice daily to promote healing from within. 4. Epsom salt. Epsom salt can provide relief from the agony of a pilonidal cyst. It has several healing properties that will help reduce and heal the cyst very quickly. The magnesium sulfate in it can aid the expulsion of pus from the cyst. It will also relieve associated pain and inflammation. Add 1 tablespoon of Epsom salt into 1 to 2 cups of warm water. Mix thoroughly until the salt granules dissolve completely. Soak a cotton ball in this solution and apply it on affected area for 20 to 30 minutes. Repeat once daily for several days. Alternatively, you can take a hot sitz bath in warm water mixed with Epsom salt. When adding Epsom salt in bath water, use 1 cup of the salt for every 6 inches of water. 5. Castor oil. Castor oil has high anti-inflammatory properties that help relieve pain and reduce inflammation associated with pilonidal cysts. It will also promote faster healing. Soak a cotton ball in warm castor oil, apply it on the affected area and secure the cotton ball with a bandage. Reapply 2 or 3 times daily, using a freshly soaked cotton ball and fresh bandage each time. Follow this remedy until the cyst disappears.